Hello everyone. In this presentation we are going to discuss about a health promotion model called Proceed model. This model is used for planning and evaluating of community health intervention programs. This model have two major branches which I call Proceed, which is the assessment branch, and the Proceed, which is the implementation and the evaluation branch of this model. But first of all, we are going to look at the Proceed branch, which contains 5 major phases. These 5 major phases are social diagnosis, epidemiological diagnosis, behavioral and environmental diagnosis, educational and organizational diagnosis, administrative and policy diagnosis. The second branch, which is the proceed level, which deals with the implementation and the evaluation process, includes 4 major branches, and they are implementation, process evaluation, impact evaluation, and the outcome evaluation. Before we proceed onto the actual pictorial diagram of the model, we will first of all look at 4 importance of this model. These 4 importance of these models are: it helps to engage community members in the designing and then planning and implementation of their own health interventional programs. It helps to assess the needs and priorities of the communities. It is also very receptive to the constellation of factors that impact the health needs of the community members. It also gives you an idea of the quality of life for community members, as this intervention itself is placed in the core of the community needs. Now we will look at the actual diagram of the model. This model, as you can see, we have the 5 levels, which are the assessment level. They are at the top of the grids that are inside the diagram, the pictorial diagram itself. And below you can see the 4 phases that deal with the evaluation and the implementation of the program. If you look at it, the block that contains the health education might be the specific place you might put your health intervention program into. That program itself can be impacted by the policy issues. For instance, if we use smoking as an example, let's say in the community, in an environment like Wichita State University, if they want to establish an interventional program that will address smoking issues, that could be affected by policy and regulation issues, which would be established by the university authorities. The smoking, which will be the health focus, the health interventional focus, can be affected by the predisposing factors of people. It could be affected by the enforcing factors of the people. It could be affected by the enabling factors, and these enabling factors can as well be affected by the policies and regulations of the organization, which in this instance we are using Wichita State as our example. The behavior and lifestyle of the people can be affected by the predisposing factor, reinforcing factors, and the enabling factors. And we can also see a flow of information, or kind of a connection between the enabling factors, the reinforcing factors, and the predisposing factors. Those two can impact each other in some way. The environmental factor can be affected by the enabling factors, which is also affected by the policy and the regulations of the organization. If the behavior and lifestyle of the people are impacted with the environment, this could have impact on the health of the people. And if the health of the people are enhanced, we could potentially say that quality of life would be improved. And if we understand it from that perspective, now these 4 phases at the bottom helps us to implement and be able to evaluate the progress of that intervention. Now we will look at the individual functions of this model. Like, we will first of all look at the proceed aspect, which has 4 major branches. The social diagnosis help you to assess and identify the community needs, describe them, prioritize them, and then be able to actively involve the community in the identification of those needs. It also helps you to assess the quality of life. The epidemiological diagnosis will help you to identify the particular health problems of the community. It helps you to identify this in respect to mortality rate, and one important thing you also need to consider is the demographics, which will be which segment of the community is mostly affected by that particular health problem. The behavioral diagnosis will help you to identify specific health-related behaviors connected to the health problems. It also will help you to select the behaviors and lifestyles based on importance and the changeability. The educational and organizational diagnosis will help you to identify the enabling, predisposing, and reinforcing factors relevant to identify behaviors and lifestyles. It will help you to select the most important factors that are changeable. This diagnosis tool will also help you to identify the factors that support and hampers the behavioral and then environmental changes in the community. The administrative and policy diagnosis will help you to assess the organizational and administrative, managerial, and policy factors that can support and hinder the implementation of the program. And this diagnosis tool will also help you to adjust where necessary the internal and external administrative policy issues to impact the success of the program or intervention. At this level, one would ask yourself, are you actually ready to be able to design a comprehensive health intervention based on the results you've gathered from the PRECEDE level, which is the assessment level? And from there, you proceed on the implementation and the evaluation level, which included 5 major branches. The first one is you put your objectives which you've developed from the PRECEDE level into action. In this level, you select methods and strategies for the intervention, and there the intervention begins. The phase 7, 8, and 9 deals with the evaluation. First of all, you do phase 7, which is the process evaluation. You do measure the intervention to control, assure, or improve the quality of the program. Phase 8, you do impact evaluation to be able to identify immediate noticeable effects of the program or intervention. And the 9th phase helps you to look at the outcome evaluation that would basically consider the long-term effects of the intervention program. Thank you all for listening. We have some references here if you want to look more into this model to be able to broaden your understanding of it. You can check on these few references that are here. Thank you very much.